Chairman Roberts, and thanks to the panel. I was here earlier to hear your testimony. I really appreciate it, some of the insights about the special challenges we face in the rural areas. I come from Ohio. We have a lot of big urban hospitals, and we have a lot of small rural hospitals. Sadly, some of them are closing down or consolidating. And I would tell you, in my state, one of the issues that is particularly difficult to deal with in our rural areas is the opioid epidemic. And I would think if you did a per capita analysis of the opioid epidemic in my state, you would probably find that in the rural areas, the problem is even more acute than it is in some of our suburban and urban areas, although it's in every zip code. But the difference is really not so much the per capita impact, but the services that are provided. And one of the issues, as you know, is that we have more and more children who are being born with neonatal abstinence syndrome, meaning they really have to be taken through withdrawal themselves. And we've got some great programs taking moms who are addicted, weaning them off of their addiction, and helping to ensure these babies are born without the neonatal abstinence syndrome. But it's overwhelming us, our neonatal units. I'm sure the same is true with you. One of the things I'm hearing about from our children's hospitals is that sometimes they can take care of the babies shortly after their birth, but then these babies go home and there's not the ability to continue to monitor, particularly in our rural areas. And so I guess what I'm asking you today is, and this, I know Dr. Murphy, you mentioned the opioid epidemic. I heard earlier, I think you were the one who talked about that. But to the hospital CEOs, maybe you could help me a little on this. What services do your hospitals offer to support the longer-term recovery needs of these growing number of children who have this neonatal abstinence syndrome, and for their moms and their families? And in particular, if you work with kids with NAS, how do you work to ensure that the families receive the support that they need?
In our community, we've certainly seen an increase in this issue. Just last year, about 11% of the babies that we delivered had this syndrome that you speak of. And we've done a lot of training with our staff to have them have the skill set to help the babies, for the first few weeks of life. And we sometimes keep them for that period of time. When they move out into the homes, and oftentimes, unfortunately, they're going into foster homes because if the mother was a user, unfortunately, they are placed with in foster families. And so we have pediatricians who try to work with these families and development, and we have like a grassroots community organization that involves the schools, early childhood development, some of our primary care providers, and together we're trying to sort of leverage and learn resources. It's a challenge because there's just not a lot of information about that. We hear from our school teachers, particularly of elementary schools, that they don't feel equipped to deal with the challenges that some of these young children bring to the classroom. And so I think just additional resources around education and training so that our workforce would know better how to help these children would make a huge difference.
Yeah. Any others?
Senator Geisinger, we're just beginning to develop a program for moms who have substance abuse and then their children subsequently born with neonatal abstinence syndrome. So the vision for the program is that we would intervene when the mother begins medication-assisted treatment prenatally, and then we would, what we say is wrap our arms around the mother and the baby with services such as behavioral health services, addiction medicine, counseling, pediatric services, and other social services that would enhance the likelihood of the mom staying in recovery after the baby is born. So the idea behind it is that we would offer these services for a period of up to 2 years and determine evaluate the model and determine what interventions really help that mom stay in recovery and go on to live a productive life.
Well, thank you. And we did pass legislation here called the Comprehensive Addiction Recovery Act, which has a separate title for pregnant moms, postpartum moms, and these kids with NAS. Since that time, we passed a budget which increased the funding for that. So for those of you who aren't aware of that, apply for it. We're looking for good pilot programs around the country. But I think Ms. Martin's right, Dr. Murphy's right. This is, if we can spend some money up front to avoid some of the longer term problems and figure out what works. You mentioned information and the right kind therapies to be able to help these babies as well as their moms take advantage of this moment. Many of these moms are facing their addiction because of their pregnancy. In other words, they don't want their kids to be born with this syndrome, so they're willing to go into treatment that maybe previously they were not. And I think Dr. Murphy is right. How do you then, once the baby is born, to keep them? Usually it's a Suboxone treatment. It's a weaning off of the opioid. How do you then keep them into that treatment program on longer-term recovery and use that family relationship to help kindle some better prospects for longer-term recovery? So anyway, we look forward to working with you all on that. And I think in the rural hospitals, again, the rural setting, we have a particular challenge. And I appreciate your being here today and look forward to following up. I have another question on the Stark Law, but I will offer that as a question for the record. Senator Bennett and I have some legislation I want to get your views on. Thank you.